Welcome, everybody. We're beginning the webinar at this time. As you just heard, you are in listen-only mode. So if you have any questions for our presenter today, just pop them into the chat and we'll help monitor that at the end of the session. My name is Patty Taylor. I'm the Director of Quality and Patient Services at the Dallas-Fort Worth Hospital Council Foundation. Thanks for being here on St. Patrick's Day. Happy St. Patrick's Day to everybody. We're hosting this educational webinar in coordination with 6SigmaTek, an associate member of the council. Today, we'll be discussing Lean Six Sigma Yellow Belt Training for 2022, a virtual online course we will be offering this year to our hospital members. The Six Sigma Yellow Belt certification is aimed at those new to the world of Six Sigma who have an interest in developing skills involving teamwork, data analysis, and problem solving. The certification course adopts the approach of advancing the concept and potential of using Six Sigma tools and methodologies within an organization. In my past, I have worked with Stephen Griffin and offered yellow belt and green belt classes. So I'm super excited to reconnect with Stephen today. So our speaker is Stephen Griffin, CEO of 6SigmaTek. During his career spanning 2 decades, Stephen has mentored over 2,000 Lean Six Sigma yellow belts and 700 Lean Six Sigma green belts. He also trained over 75 surgical and emergency room residents at such facilities as Our Lady of the Lake Region Medical Center in Baton Rouge, Louisiana, saving hospitals and companies over $190 million through to continuous improvements. I know I am looking forward to his presentation. Again, thank you for taking time out of your day today to be with us. And I will turn it over to Stephen at this time.
Thank you, Patty and Chris, and hello, everyone. And as Patty has already mentioned, happy St. Patrick's Day. So with that, we'll just dive right in. So again, this is the Six Sigma Yellow Belt course. The course objectives, I won't read them all, but I can read many of them. You're going to learn the fundamentals of Six Sigma. You're going to learn the DMAIC methodology. You're going to drive transformational change in your organization. Now, someone may say, well, what does that mean? That means that you will be empowered to solve the problem, because most of you, if not all of you, know the answers. And we want to empower you to do exactly that, solve the problem because you have the answers. You're going to learn how to incorporate something we call the voice of the customer, or the process and the patient, where you're actually going to be driving change and transformational change from understanding the data and understanding the patient needs. You're going to also learn to engage your stakeholders and your patients. Who are your stakeholders? Stakeholders can be another nurse, it could be a C-suite member, it could be a surgeon. You're going to actually be able to engage with all of these people to drive for a solution. You're going to create a multidisciplinary solution. This means you may span over a couple of different departments. You may be in a position where you have to work with 3 or 4 different areas that you're not familiar with. But that experience of being able to transcend, all of these roadblocks and these walls is going to grow you as a professional. You're going to engage with the physicians. As we said, there may be some situations where they're going to engage with you. You're going to remove what we call waste. Waste are anything that the customer or the patient is not willing to pay for. And we're going to get into that in just a few. You're going to have the chance to do brainstorming and create control plans. How many of you have ever worked on projects or have seen projects, and at the end of the day, everyone says that was a good project, and 2 weeks later, the problem comes back? Well, not with you. That's not going to happen with you, because we're going to work with you in regards to creating a control plan that will sustain and maintain all of your improvements. Now, what is a transformational project? They come in all fits and fashions. Here's some ideas. It could be lab throughput, reduce the COVID length of stay. That's a big one. That's a big one on everybody's mind right now. Reduce the ED length of stay. Reduce the length of stay for pneumonia patients, reduce CHF, reduce sepsis. The same things that we had going on before COVID, we still have issues with today. It could be reducing 30-day readmission. These are the types of projects that you can bring and achieve your yellow belt certification. I know a big one right now is reducing falls. Falls is still a problem. Falls has been a problem since the dawn of time. So guess what? You have a chance to work on this and get your certification doing so. It could even come down to, call light wait times. Why does it take so long when I hit the call light for someone to come into my room? So any project that is going to better that patient or better the hospital processes would be considered a transformational project. Now, what are these wastes? So all of your projects that you bring to the class, they must attack one of these wastes. So you have waiting is a waste. So a project that deals with reducing the wait time, overproduction or something around why do we perform so many tests? Why are we doing so many unnecessary activities? Rework, and it stands for exactly what it sounds like, rework. This could be dealing with cases. This could be dealing with patients. This could be, my brother, bless his heart, was a diabetic. Sometimes he had to get stuck 2 times because they could not find a vein. So that right there is not a patient satisfier. I can promise you that. So that is something that we could look at as well. Motion is a waste. Moving things around, having to go different places, travel long walks to obtain what we need. Why does the nurse have to leave the triage room? Maybe she doesn't have what she needs, so she has to leave the room and go get what she needs. Well, me as a patient, I'm like, where is she going? I need help right now, right? So motion, processing, extra processing, variation. Everybody does it a different way. Therefore, every time we have a situation, the outcome is different. So variation of processes is also a project. Reducing inventory, better known as hoarding. Let's get rid of the hoarding. There could be situations where we may need a particular item. We can't find it because someone is hoarding that. So this could become a project. Let's reduce inventory or make sure that we have just-in-time inventory for a process. Waste of intellect. This is a good one. This is a good one. Why do we need a surgeon to help us remove waste of inventory, right? Why do we have to go out and email people to help us do certain things when they are not even what we would call the subject matter experts? And then the final one is transportation waste. Transportation waste. Think about transport. They have a very hard job. As a matter of fact, go up to a transporter today and tell them Steve Griffin said he loves them. Okay. Transport is a necessity, but sometimes we can overuse them. So we can look at a project around transport. Let's make their job efficient. So these are the 8 wastes that we are talking about. So all of the projects that you bring to the class, they must match or have one of these wastes involved, because this is what you will be fixing or eliminating in your project. Now, how does the class work? So it's going to be a 1-hour class by me. It's going to be a virtual class or webinar. So you will come to the class, but prior to that class, you're going to send me a project charter. So I'm going to send you some information about a charter. I'm going to send you some examples on how to do a charter, and I'll probably send you some examples of older charters. So what you're going to do is you're going to do the best you can to create your project charter. You're going to get that to me prior to the class. Then I'm going to work with you as an individual to get your charter in a different format or get it up to a point where we can now begin your project. So before class, you will have to create a project charter. The second thing, please, you must obtain your manager's approval, not only to come to the class, but your manager will probably be your biggest advocate, right? So you want to make sure that you work with your manager, because there may be some roadblocks that you're going to need. And also with your charter, that charter should be created with your manager so you're all on the same page from the start. Determine the processes that you want to improve, right? All of you come to work every day and you see one of those 8 wastes. And I know you go home and you say, boy, we do that process so stupid. Why can't we fix this process? Don't they understand what's going on? People can't see everything that's right up on them. You, as the subject matter expert, you can see it and bring it to the class and work with your manager on reducing or eliminating one of those 8 wastes. Match the excuse me, match project to one of the process waste. We just talked about that. Now, step 5, in regards to a month's worth of data, some, depending upon the project, you may not have that, but if you can get 1 month worth of data prior to class, that's going to be huge in regards to how fast we can get you started on the right track. Because if not, we're going to be, using a lot of time to obtain that data. So you need to know up front, if I choose this process that's going to work on this waste, I need to find data around this process. Register and pay for the class, that goes without saying, right? Complete your project charter. I'll give you all that information for those who want to register. Once the project charters are received, you will be assigned a mentor. Here's the part that gets me real giddy. Your mentors are all healthcare professionals. They are not manufacturing people, and we're not talking about building cars. These are people with real jobs, and they work in healthcare, and they are willing to help you, and they can speak your language and understand your pain. So once I get all of your information, you will be assigned a mentor, and your mentor will work with you all the way through your entire project. Some people might get me as a mentor. I mean, that's good. I'm not clinical, but I like to be. So you're gonna have a mentor. So don't worry about it. We have your back on that. Attend the whole class. Don't get on class and then go out for a break. Attend the class. I'm going to need you to be mentally and physically present. During the class, I will call on people to ask them questions about their projects, and I would hate to call on you and you're not there. So you must attend class and stay in class for the entire time. You and your mentor will create a solution. You're going to create a solution. Now, here's the good thing about what we're doing with the yellow belt, and something you're going to hear me say a lot of. A lot of you may come into these projects with an elephant. Your project, you may consider it to be an elephant. Well, as a yellow belt, I want you to work on the elephant's toenail. So I want you to decompress. You don't have to solve the whole elephant. I just want you to work on the toenail. Now, the one thing that we're okay with is, let's say that you've created a solution, but it can't come to fruition for 30 or 60, 90 days, but you have a solution in place. That is good enough. If you can't implement a total solution, as long as you have the plan to follow through after the certification time, that is good enough. What we care about is that you're using the tools to get to that point where you have a solution and you're working with your mentor. Now, you have 60 days to do this. So it's 60 days. It depends on how you work. It could be a long time or a short time, but you have 60 days to implement a solution. Now, have I seen projects go past 60 days? I have, and we'll get into that later on. Now, once you create your solution with your mentor, you're going to have to create a presentation. You and your mentor will create a presentation that you can provide to your management team. So you have to create a presentation, and you and your mentor will do that based on all the tools that you're using and your solutions. And then after that, we're going to celebrate, because then you will have your Lean Six Sigma certification. And by the way, just in case anyone was wondering, for Yellow Belt, you do not have to take a certification test. Just want to make sure we're clear on that. Now, in regards to the cost, we have a couple of options, and I'm excited to talk about my last 2 options. So you have option one. Option one, which is $550. You get 12 mentoring sessions via email with your mentor. Now, Does that always happen via email? No. A lot of times there will be some phone calls, but we have to structure something. Okay. So, but there's 12 mentoring sessions via email with your mentor. You're going to obtain, we're going to give you the material as a PDF. We're going to give you a yellow belt toolkit, which is all these cool Excel templates that you actually will be using in your projects. Okay. And your mentor will send you the schedule that they're available. So once they send you that schedule, that's how you get on their schedule for the 12 mentoring sessions. Now, again, they're all experienced healthcare professionals, and you also get a customized certificate from me as well. So that's option one, which is basically 12 mentoring sessions over a 6-month period. Option two, which is $850. Same as far as the material and the Excel sheets, but what you get with option two, you get 6 sessions via Microsoft Teams or Zoom or whatever. You get 6 Zoom sessions and 6 email sessions. So you still get 12, but now you're going to get these sessions where you and your mentor are face to face, and you guys can work on all of your issues. And these sessions face to face are going to be 30 minutes apiece. So option one is complete email. Option two is 30-minute face to face, 6 of those, and 6 emails. That's option two. Now, what I'm proud to offer this year is option 3 and 4. You can now receive credits as far as your learning credits. Okay. Now, for option one, it's quite expensive. For me to provide nursing credits or CEUs, it's costly. So we had to go up on the price. I'm working on trying to get that down, but I'm just glad to be able to offer that to you as a yellow belt. And basically, option 3 is basically option 1 on steroids. You will get 10 contact hours by going this route, option 3. And option 4, the same thing, is option 2 on steroids, and you get 14 contact hours by going with option 3 and 4. This is something that we just launched this year. It took me a long time to work with some agencies on being able to do that. So I'm glad to have that. It may not be the season, but it's definitely an option for you if you need those CEU credits. Now, what am I expecting? I expect you to come to class. It's an 8-hour class. I can probably get it done in 7.5, if not 7. It depends on how well we're moving through the material and the number of questions. Okay. If that's too much, we can do 2 4-hour classes. I know right now with COVID and everything that's going on, you probably cannot be away or off the floor for a straight 8 hours. I'm willing to work with the whole team. We can break it up into the 2-hour sessions, and I can even go outside of this. It just depends on the number of participants. So bottom line, you have to get 8 hours done, and we can spread it out however we need to based on the situation. Again, you are expected to have a solution implemented, or at least a plan of a solution implemented within 60 days post-training. Each one of you will have to work hard because 1, you have 60 days, and 2, this project is something that's important to that patient, it's important to the hospital, and it's important to your career. So we are expecting that you're going to work diligently on accomplishing all of those, if not more. You have to use your mentoring sessions. This is what I want to say. Your mentors, they take time out of their day to work with you. When you do not come to them, that to me is just unprofessional. So they're going to take their time out, and they work just like you on the floor in the units. They're going to take time out of their day to work with you. Please, as a professional courtesy, make sure that you utilize all of your time. Please do that. Again, we looked at the approved project. So by the time you come to first day of class, I'm expecting that you have already talked to your manager, You basically know what your project is. You have some data, or you have an idea of where to get the data. Now, do projects change during the course of the 60 days? Yes, they do change. So when they change, we change. So we're agile with you, okay? We can't have the project change 3 times. I can see once, okay? So other than that, if your project changes, we will adjust to work with you. Not a problem. Each of you must consult with your mentors in regards to transparency. This is what I mean by that. If you come into the class and you know that you have vacation coming up, now some things you can't control, I understand that. But if you know you have vacation coming up, please be transparent with your mentor as you're making the schedule. Because once they give you that time, their obligation to you is done. So you have to make sure you really look at your schedule in those 60 days to make sure that you can hit all of the mentoring sessions. Okay. Now, some of the other things that we do besides the yellow belt, green belt, and black belt, we also do one-offs with ED flow. We have a class on ED. We have a class on lab design, OR. We also do the Malcolm Baldrige consulting. One of my consultants also is a leapfrog genius. And so, but that's, these are just some of the things, some of the other things that we offer as well. Now, FAQs. Okay, so first question. What if I pay for training but drop out? Fees are non-refundable. You can retake the class one time only after that at a 50% discount. So again, make sure you have the time to put into this, this initiative. What happens if I cannot finish in 60 calendar days? Well, I'll give you a 10-day extension. Really, basically what I'll do, I'll work with you. I had to put something out there, but I will give you an extension. And if you're having issues with that, then you and I will work together. We will leave no one behind. Everyone will get their certification, but you have to be transparent with us and you have to give it your all before you start asking for different concessions. I want to make sure that you're doing the best that you can. Okay. Do I need to recertify once I get this? No, you do not have to recertify. Is my certification recognized nationally? Yes, everything that we do is based on the ASQ body of knowledge, and I am able to provide certification with my Six Sigma status. So yes, you will be recognized nationally. As I've already said, you do not have to take a test, not for yellow belt. You do have to take a test for green belt and black belt and master black belt for those who want to do that. How do I receive my certification? Again, you have 60 days or less to complete and submit your presentation with a solution, or at least a planned solution. Once you and your mentor agree to that presentation, the flow, the fit form, the function, and the flow, I will look at it as well. And after that, we're going to say you're good to go. This is ready for you to submit to your management team. How many people can be on the team? This is a tricky question. 3 people can be on a team, but if you're the only one that's paying for the certification, only one person gets certified. I have to make sure that that's clear. I had a team once, I allowed them to have 4, but only had 1 yellow belt participant, but everyone else thought they were getting a belt as well. I'm like, no, right? So you can have up to 3, maybe 4 on the team, but only the person that has signed up for the yellow belt gets the certification. So as you choose your team, you need to make sure that they understand that, because it's only going to be for you. The nursing credits, again, we kind of talked about that. What happens if I cannot finish the project? We've talked about that as well. So these are the FAQs. I'm sure there may be more questions, but these are our standard questions. And with that, I'd like to thank you. And are there any questions for me?
Hey, Stephen, let me check here. If anyone has a question, please feel free to type it in, and we'll have Stephen answer them for you. Question here from Jessica. She was asking if there's going to be any content covered in today's presentation. I'm not quite sure what she meant by that.
I'm gonna say no. No content. I'm gonna say no. No particular content, unless I'm not. To your point, I'm not. Unless I'm not understanding the question.
Okay, yeah, she said that answered her question.
Oh, okay. That was the easy one. Okay, I like that.
Okay, we got a question here. Can each member of the team sign up and register and work on the same project together?
Yes. Yes. If 3 of you want to be on a team, or again maybe 4 want to be on the same team, and you have registered, the answer is yes. You will all get your certification. Absolutely.
Okay, we got another question here. When do classes begin, or is it on a rolling basis?
That's a beautiful question. That's something that I will provide Chris with in regards to the scheduling. And I think the last time we went, I don't know, what was it, Chris? Maybe a month or 2 after this series, we started the class. But I'll give him some dates, and then we can go from there.
Yeah, it was about a month later that we set up the dates.
Okay, yeah, about a month later. So possibly a month from today, the first class will start.
Yeah, and everyone who has registered for this webinar today, whether you attended or not today, will be receiving that information.
Good question. Thank you.
Okay, do we have any more questions? Feel free to type them in.
Hey, Chris and Stephen, this is Patty. I just wanted to interject my personal experience. So I did take the yellow belt class, and I was one of those that came in with the elephant, wanted to solve the world's problems. And Stephen was amazing about helping me, and I had trouble, but he helped me figure out that toenail and that piece that I needed to work on to be able to make a difference in that 60 days. So him and all of his mentors will do a great job counseling you that way and guiding you to be able to get it right.
Thank you for that. And to make sure that we stay on track with that, something that we're going to interject in this class. So once you sign up for the class and your mentor gives you their schedule, depending upon your option, we're gonna actually tell you exactly what you need during this time. So you're never gonna guess, what am I supposed to be doing? You're always gonna have the schedule of exactly what you need. So some of those mentoring sessions could be more or less, hey, Steve, did you turn in your process map? Yes, let's talk about it. I like it. Does it explain the process? Yes. You're good to go for that initiative. So you're gonna have a schedule of exactly everything you need and when you need it, so there's no confusion. That was the feedback we got from our last class, and we always listen to whatever you guys say, and you talk, and we do exactly what you need us to do.
Okay, it looks like Audrey here has raised her hand. Audrey, if you have a question, just type it into the questions box. We'll have Stephen answer it for you. Okay, here we go. My organization will have to budget for this. Will there be options for additional classes?
Yes. Yes. I'll do it. Yes, I will work with you, and I'll work through Chris to make that happen. Absolutely.
Okay, thank you, Audrey. If there's any more questions, please feel free. We're getting ready to wrap it up.
And I do see one question in the chat asking if this PowerPoint will be shared.
And it will be shared. I'm going to send it out to everyone who registered for this webinar this afternoon.
I guess I just had one more thing to say. I'm sorry. Was there another question? I'm sorry.
No, it looks like we don't have any more questions at this moment.
Oh, I guess the one thing I'd like to say, we've been doing this quite a while, and it's been a beautiful marriage. And I'm gonna tell you guys, when you come in for this yellow belt class, and you can actually see your actions make a difference, and you see the data, and now you're charting things, you're creating solutions, and now you're already a subject matter expert, but now we're making you a super SME, right? And this is the start of your journey to be a process genius. And I really want you guys to think about that, because this is how it starts. And because once you catapult through this, green belt and black belt are going to come so naturally, because actually I have seen quite a few yellow belts. As Patty said, they had an elephant, but we took the toenail in the yellow belt, and guess what? When they went after their green belt, it's still the same project. It just expanded the scope. So you could possibly get all of your belts on one process. We're just going to scope it different for the particular class. And we love doing this type of work. I'm excited, and I hope to see all of you guys real soon.
Okay, I think that about wraps it up. Thank you, Stephen, and thank you, Patty. We really appreciate your presentation today. This has been great, and we're looking forward to working with everyone, and we're looking forward to what you have to offer this year, Stephen. So thank you.
Thank you.
Thank
Hold on,
you.
we have one more. We have one more question here.
Oh, okay.
Do you also offer green belt certification?
Yes, and black belt and master black belt.
Okay.
Yes.
There you go, Felicia. Thank you so much for your question. Okay, with that, I think we're going to wrap it up. Thank you, Patty. Thank you, Stephen. A great webinar, and we're looking forward to the yellow belt classes that are going to take place. And thank you to everyone for attending. Thank you.
Thank you so much. Bye.